This is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. The current issue of the Migration Health Research Bulletin number 29 features publications focusing on migration health concerns affecting migrants and mobile populations, including access to healthcare services, mental health, and infectious diseases such as tuberculosis, HIV, and COVID-19. For our audio podcast episode, we discuss with Dr. Nevin Wilson, former Senior Regional Project Coordinator for the Middle East Response in IOM Jordan, the prevalence of current tobacco smoking among patients with TB and people living with HIV in Jordan, and the assessment of the sociodemographic characteristics associated with the study population. Let's listen to Dr. Nevin.
This study aimed to determine the prevalence of current tobacco smoking among patients with TB and PLHIV in Jordan, that's people living with HIV, and assessing the sociodemographic characteristics associated with current smoking within the study cohort. To give you a brief background, previous studies have shown that smoking aggravates TB symptoms and increases the probability of drug resistance, recurrent TB, poor TB treatment outcomes, and death. Similarly, continued smoking by people living with HIV contributes to increased risks of cardiovascular disease, neoplasm, chronic obstructive pulmonary disease, and other HIV-related infections with shorter lifespans than non-smokers with HIV. This region, the Middle East, is one of the highest tobacco-consuming regions in the world. Despite being a low TB and HIV burden country, certain vulnerable groups in Jordan, such as economic migrants and refugees, are disproportionately affected. And data of tobacco use among TB patients and PLHIV in Jordan is currently lacking. The principal author of this paper, Ms. Ayaka Teshima, she interned with me in 2022 with the objective of learning and implementing operational research using program-generated data. And this paper is the main outcome of that internship.
Can you kindly tell us who are the primary intended users of this article?
This paper is addressed to healthcare professionals and program managers in the National TB-HIV program, particularly in Jordan, and policymakers in the Ministry of Health in Jordan. It also speaks to donors and partners working with the health and development sectors in Jordan and any researchers who are keen on engaging in migration health policy.
And what are the key findings from the study that you would want to share with us?
Our study showed that nearly half of tuberculosis patients and about 70% of people living with HIV were current smokers. This was higher than the general Jordanian population. Conventional cigarettes were the most used tobacco products. In addition, a considerable proportion of TB and HIV patients who were current smokers from non-Jordanian origin, particularly from Palestine and Syria, most of whom are refugees or economic migrants and considered to be vulnerable populations. Those experiencing financial difficulties were more likely to smoke compared to those without financial difficulties. Although we observed predictors such as gender and socioeconomic status associated with current smoking, the underlying reasons for high prevalence of smoking among the population remain unexplained, and further research is needed to investigate smoking among TB and HIV patients who are at high risk for tobacco-related disease burden. It is still hypothetical, but stigma and discrimination may be a potential partial explanation. For instance, a knowledge, attitude, and practice survey that we used to obtain this data indicated that patients with TB and people living with HIV face high levels of stigma and discrimination after the diagnosis of their disease. Patients with TB and PLHIV might be compelled to smoke excessively or take up smoking to overcome the social, economic, and mental stress induced by the diagnosis of these diseases. Further research will help in understanding the causes of high levels of current tobacco use and support the design of context-specific interventions to address current tobacco smoking.
And based from these findings, Dr. Nevin, what are the implications of the findings that you have shared for policy or program?
First, there is strong evidence linking smoking by TB and HIV patients to poor treatment outcomes, including death. Hence, Irrespective of the causes of high levels of current tobacco smoking, there is a need for the introduction or integration of tobacco cessation services into both the TB and HIV treatment services. In Jordan, currently tobacco cessation services that include the provision of nicotine replacement therapy are implemented mostly as a part of cancer care, and a similar approach needs to be adopted while introducing it as part of TB and HIV treatment services. Second, while including tobacco cessation services as part of TB and HIV treatment services, care must be taken to ensure that the services are tailored to the sociodemographic characteristics such as gender and nationality of the patients. For example, although males were more likely than females to be current tobacco smokers, about 21% of the female patients with TB and a third of the female people living with HIV were current smokers, and this is not a small number. Similarly, significant proportion of the patients with TB and people living with HIV who belong to a nationality other than Jordan are also current tobacco smokers, and therefore care must be taken to customize the cessation services to suit persons of other nationalities. Third, the Eastern Mediterranean region is one of the regions with the fastest growing consumption of tobacco products. The growing prevalence of smoking can negatively affect TB and HIV burden in the region. This can hamper the achievement of TB and HIV elimination efforts in the country and in the broader region. Hence, the TB and HIV control program has a very important role in advocating with policymakers on the need for large-scale interventions for tobacco control, which, if not done, may increase the demand for resources to provide TB and HIV services later. Finally, there is a need for establishing mechanisms for tracking the trends in tobacco cessation among patients with TB and people living with HIV, and to assess the effectiveness of these measures being undertaken to reduce the tobacco smoking burden in these persons. This can be done by revising the recording and reporting formats to document tobacco consumption status during TB and HIV treatment.
Thank you very much, Dr. Nevin, and thank you all for listening. Please feel free to share feedback with us. See you on the next podcast.